Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Amla Pitta in detail and we have seen three different sampratis actually which we come across in our clinical practice. First one, which is mentioned in the text, Agni Madhyakara Ahar, then Agni Daurbalya, and any food which is taken, it gets fermented and the symptoms of Amlapitta appear. This is the first. Second, Tishna Ushna Ahar, and because of Tishna Ushna Ahar, there is internal mucosa damage, and because of that, patient is more prone for the conditions like ulcer. And third condition, whether neither of first to happen, there is only many times early in morning vomiting sensation, or many patients induce vomiting in the morning because they have that sensation, and after vomiting they are very much happy throughout the day, or sometimes they take some antacids as a shaman chikitsa, and in that case also we have to consider this as a patient tells this is amla pitta or acidity. So these are the three main conditions we come across under the heading amla pitta. Now there are other few conditions which are also to be considered when a patient is complaining of acidity or amla pitta. You may find that I am taking more lectures on amla pitta because this is a very common symptom which we come across our practice, and hence all aspects of amla pitta are to be taken into the consideration to cure the patient, because as I we see three different patients in previous lecture, and the samprapti of all these three is totally different. That's why I am taking much more time. So after these three major types of patients of amla pitta, there are some other conditions also where patients comes to you and tells that I have acidity. First one is side effects of the medicines. It is very common, whether it is antibiotic or any other heavy medicine or long-term steroids, painkillers, long-term painkillers. These are the main reasons where patient feels burning, vomiting or daha symptom. So when a patient comes to you, you have to take in history whether medicines are any such medicines which will increase the pitta in the body is going on. First thing. Secondly, in some patients, like in the case of cancer, the chemotherapy is going on and the medicine is for after a certain interval, for some in patients 7 days, after 21 days, and so when the chemotherapy is induced at that time, after chemotherapy for a few days patient has got acidity, and the effect as reduces of the chemo drug gets reduced, the acidity also gets nullified. In such patients, you can start the medicines early before the chemotherapy. We are going to come this point in the when we will discuss the chikitsa. Third aspect of this is stress. Patient tells that don't have these symptoms previously, or I don't have any acidity, but nowadays sometimes it gets fulminated. So you have to go through the stress factor, which is also a major factor in today's time. Fourth factor is very common, a continuous pitta prakopak ahar or vihar, and patient doesn't have any history of amla pitta, or there is no fermentation also many times, but often on this complaint rises with the change of food or change in the vihar like jagranam, atapa seva, etc. So this is another factor which is to be keep in the mind. Another thing which is very interesting and which I have seen in the patients, patient comes to you and says I have severe burning and I get very irritating and etc. Many a times this is not the symptom. Many times this is not the symptom. The reason is patient has not taken food for a long time. You can see this very commonly. I have seen, that's why I am sharing with you. Many times patients are so have ignorance about their food timings. We will do this work and we will eat. I will do this work and eat. I have no time. Why I should waste time? I have so much of work pending now, so I will eat after some time. So empty stomach for a long time also induces acidity, because the secretions of the juices of gastric juice or other enzymes is already done by the body in natural way. So always check this factor also, that if patient is having lack of food in the specific time intervals and is eating either in less quantity or after a long gap of between two meals or two food timings. I will share you an interesting case. And there is a my patient, and she complained that every day in the evening only I get acidity, 5 o'clock, specifically 5 o'clock. Now, as I told you that when there is pitta by Dravaguna Vruddhi, we see in the morning, because overnight accumulation of pitta tries to get out of the body, or there is body sensation. But she told me that I have problem acidity from the my throat life, because she was so fermenting pitta prakriti. But nowadays in the evening, especially at 5 o'clock, I start that burning and sensation and pitta prakop symptoms. I was very astonished, because it was not in the previous months. It was not such type of symptom with a specific time. So when I asked about Ahar Vihar, is any changes or what you take at that time, she said that I take a very concentrated tea with lot of ginger in it. The patient itself is of Pitta Prakriti, fulminating Pitta Prakriti. She was on the chemotherapy, she is on the chemotherapy, so already there is Pitta Prakop Lakshana, and in addition, she is taking such a tea with high concentration. She used to get more boiling when in the preparation of tea with lot of ginger in it. So I asked her to stop that tea, and after that the symptom was automatically relieved. So when your patient is saying specific time of the symptom, always think of the Ahar Vihar in that relation. Another factor which is you are all knowing this is Pitta Prakriti itself. Patients with very ekantic Pitta Prakriti or very dominance of Pitta, even small alteration in the Ahar Vihar also acts as a trigger point, and such symptoms of Amla Pitta occur. So you have to convince the patient that your diet, your Ahar in a such a way should be in a such a way that you should not give any chances to the pitta dosh which is naturally in the dominant side to get aggravated. So these are the small factors which also contribute in this disease. So I have discussed in this lecture. From next lecture we will move towards the chikitsa of Amla Pitta. Thank you very much.